Hi there. As we've said, I've had metastatic breast cancer for 9 years. My regimen is Herceptin drip infusion every 3 weeks, and Tykerb pills three a night, and then I have Xeloda pills, which is 1 week on, 1 week off, 5 pills a day. So as we said, in '93, I found a lump in my left breast, and at 36, I was considered fairly young for that. At that point, it was stage 1 cancer. Many years later, I had a backache, and I was not thinking about cancer at all, and I developed a slight cough at night, and I started finding it difficult to walk up steps, and we were in a brownstone, the 3rd and 4th floor, and so I started noticing that it seemed to be getting harder to get up the stairs. It took, unfortunately, a year to figure out that it was cancer in the lungs. And so I had a lung CAT scan, which showed tumors, and a VAT, which is video-assisted thoracoscopic surgery into my lung, which showed that the tumors were stage 4 metastatic breast cancer. I began treatment with my former oncologist, Dr. Ann Moore of Cornell Weill, who's fantastic, but she didn't take insurance. And initially we thought, oh, I'm just going to do a few months of chemotherapy and then I'd be okay. And then we realized, oh no, it's not going to work like that. So I interviewed some oncologists, and we chose Dr. Ruth Oratz, who's wonderful, from here on NYU. Excuse me. Last year, I had the. Oh, okay. I think I may. Oh, okay. Yeah. Thanks. Sorry about that. So last year, last April, Dr. Conciaco, Dr. K, one of our NYU neurosurgeons, gamma knifed 14 brain tumors. And within 2 or 3 months of that, they were shrinking and disappearing, which I just thought was a miracle. You know, in fact, when we went to hear what the results were after the first PET CAT scan, I was expecting they would say, well, they're a little bit shrunk, but they were some were actually, dead, gone, and it was such a better result than I was expecting. So I was talking with my METS group, my discussion group that meets here, and I was saying, what do you think people would be interested in hearing? And they all said, definitely about the gamma knife, because that's such a wonderful situation for me and for a number of people that I've spoken to. So, the gamma knife is the stereotactic radiosurgery, and it's managing metastasized brain tumors. In spite of the name, gamma knife is not a knife, but it's rather a system of delivering very precisely targeted radiation treatment. The neurosurgeons and the radiation oncologists work together, and they use highly detailed MRI images to create a customized treatment plan for each patient. Then the gamma knife system directs multiple highly targeted radiation beams into the tumor, and it's basically in one treatment. At least that's what it was for me. Wow. The critical brain areas around the tumor receive only a very low radiation dose, if anything at all, and that's another great thing about this procedure. There are many small rays, so the brain area around the tumors is not getting zapped with, high-powered radiation. It depends on the precise delivery of multiple tiny radiation beams. So I wore, and the patients wear, a head frame during the procedure, which prevents us from moving. So we have a frame. These days, it looks like to me, a superhero mask, and it's made from titanium, and it just allows for very precise positioning of the treatment target. It's an outpatient procedure, and it just takes usually a few hours. NYU has had this equipment for years, but when Hurricane Sandy came, the machine was flooded and destroyed. It weighs thousands of pounds and costs millions of dollars. There are only a few in the United States. My doctor, Dr. Conciaco, helped suggest improvements to the equipment so that the headpiece is much more comfortable than it was years ago. About 5 or 6 years ago, they screwed the contraption onto your head, and after they did that, after the procedure, those spots really hurt, and they could get infected, although I didn't hear about that happening. Now it's more like a mask, so they still screw it in, but it's not as tight, and it's just a mask that holds your head in place. Dr. K is an expert, and he's written over 450 articles, as well as contributed to over 200 book chapters. We're very lucky to have him, in my opinion, and I see this procedure as almost magical. Of course, it's a testament to the science and research and around cancer and at our NYU hospital, cutting edge. Sources of strengths for me through the last 9 years have been my husband, who I sometimes call Dr. Ken, because he is constantly reading every single day about things, almost to the point where I'm like, can we talk about something else? And my mom and my doctors, Dr. Oratz, of course, Dr. Moore. Dr. DeAngelis is over at Sloan Kettering, and she's a great brain doctor. And of course, Dr. Conciaco and his neurosurgery team. I belong to a Mets cancer group, which I find very helpful. We find helpful talking with each other. Sometimes the issues that come up for us are different than the issues that some newly diagnosed patients are working with. So I've heard that when you have a group that's got both the newly diagnosed as well as the old timers like me, the newly diagnosed kind of look at us like, oh no, we're going to be there someday. We don't want that to happen. So there's different kinds of things that we end up talking about. I also belong to SHARE, which is great for information. And there's a Hudson Valley group called BCO, Breast Cancer Options. They have an annual free retreat at the Omega Institute, and that happens in October, and people who are in that area are able to go for free. And that's kind of my story. Any questions? Comments? Thank you. I get by with a lot of help from my friends. Yes?
The gamma knife, you said that many people are interested in that. Can that only be used for the brain tumors, and was that ever considered for your lung cancer or your breast cancer?
My lung cancer reacted pretty well to the Herceptin and the various drugs that I was on. They were even pre-chemo drugs. So those shrank for the most part. There was one point where, and this is when the brain tumors came back, where we took our eyes off the ball a little bit because I'd been NED, no evidence of disease. And so we sort of gave me a break from the various drugs. And then we didn't keep watching as carefully as we probably should have. And, but I've heard that these can be used. I don't know about the machines that we have, but it's a good question. I can find out.
It's fascinating.
Yeah.
And congratulations.
Thank you. Well, it's great. So, you know, it's been in the past where you hear about brain cancer and you think, oh, that's not so good, which of course it isn't, but, but you know, it's not necessarily an immediate death sentence.
And you have medications that cross the blood-brain barrier, which is very important.
Right.
For targeted therapy.
Yes, Tykerb does that as well as Xeloda. That's an issue where some chemotherapies and drugs don't actually go up to the brain. They don't get up there. And those drugs, well, I think there's controversy in some cases. I don't know if everybody believes that they do, but I think they do, given my, you know, my experience.
And we do some radio frequency ablation in the liver.
Huh.
So we use certain techniques that we have to use some specialized knives and beams.
Yeah. There's also CyberKnife is another type of it's not the same as Gamma Knife, and it's some other hospitals have it. And I've heard that some people have gotten some, I think, back, or they've had some work on their back done, but I don't know too much about that. Yeah. Thank you.
Keep a journal.
Mm,
Would it be helpful?
It would have been helpful, yes. I didn't really keep one, but yeah, somebody suggested that early on, and since I felt like, well, I'm going to beat this and I'm not going to need that, I kind of sloughed it off. But in fact, it would be helpful to kind of keep track of various, various drug things that happen. After a year on a certain drug, sometimes you start to really feel it. And it starts to but I would suggest keeping a journal, but I unfortunately haven't. Hopefully I'll take my own suggestion. Thank you.